So Tam has talked about the political settlement and how that's contributed to ad hoc decentralization. Basically, the presidents had decentralization foisted on them by the donors. They didn't want it. So there's been this hesitancy all the way through to release funds or power. And this has led to the fragmentation of functions and structures, overlap and poor coordination, informal re-centralization, dysfunctional institutions, again leading to dual administration and poor performance at the local level. Policy incoherence and competing mandates in jurisdictions, and non-meritorious hiring and firing of the civil service through patronage appointments, conflicting goals, poorly coordinated working relationships, and weak staffing. This has all led to poor performance, not just at the central level, but at the local level as well. And then we have a third set of factors is weak discipline. And here I mean vertical discipline down through the ranks, performance. They've passed performance contracts, but they're never enforced. And weak control across the civil service, so you're not sure who out there that is going to coordinate with you. So a senior civil servant discipline is very poor, and this leads to non-compliance. So I'm going to give you 4 examples if we have time here. This first one talks about fragmented authority and collective action failures. That is my research assistant, probably now for 5 years, a guy named Morwalita, and he's looking in a hole that's been dug in the ground inside a building in the Ndurandi market. And what we were looking for there is water. And we had been working in the Ndurandi market now for 5 years, so we have a pretty good handle on how things work there. The market burnt down in 2008, and it's never been fully rebuilt. At the moment, and it serves 200,000 people, I guess, something like that. They have 1 tap, no toilets, and these illegal wells that are dug by vendors inside their buildings, in which they're selling water at 10 or 15 kwacha per pail of polluted water that's basically coming up from the very dirty river, the Nasolo River there. So here's a water problem. So what we've looked at and said, why is this an ongoing water problem? The problem is that it's a problem, the market is part of the city, so it's in effect the Department of Health's problem. The City Department of Health, working with the Blantyre Water Board, should be sorting out all these sanitation and water problems. But they're not able to come together, typically in Malawi, come together and work as a unit. So what you have is a market master who we have been told, is aware that these wells exist. When we ask him, who do you report to about these kind of things? He says, well, my boss is the commercial department in the city. He manages the market and is in charge of the cleaners and sweepers. But the cleaners and sweepers, they don't answer to him. They answer to the Department of Health in the city. And the guards that he employs answer to the city, the Department of Administration in the city. So now we've got 3 different people in a hierarchy answering to 3 different units within the city. And there's people who sell tickets to the vendors to say you can sell here on that day, 50 kwacha to sell. The ticket sellers answer to the Department of Commerce. So now you've got 4 different units. And to get this market rebuilt, which is the responsibility of the Department of Engineering in the city, so now we've got another department, they're waiting for money from the Ministry of Local Government, which is back on Capitol Hill in Lilongwe. So here you've got a market that can't come together. One little space, a few city blocks, who can't come together and run themselves. And so this, we think, and I mean, you could do research for a lifetime in Malawi, has been a result of the way the market has built up over the years in different establishments, and nobody's come in and tried to rationalize it. So they don't work as a whole. And people who are key on the ground are not given authority to do the work that they should be doing. The lines of communication are all screwed up. And so the operations are undermined in that way. And this sort of dysfunction, because before we did this project, we worked for 5 years in Malawi on the Africa Power and Politics program. And so a lot of this work we've been doing, this sort of dysfunctional arrangements we've found across the whole of Malawi. And they're made worse by governments and politicians who come in and promise things, half build them, and by donors who come in and lay down a whole new set of institutions without rationalizing what's already there or bringing order to the existing bureaucracies and jurisdictions. So lesson number one for anybody that's here from the donor community is whenever you start a program, please go and do an institutional study of what is going on already and try to bring order to that chaos before you lay down yet another layer. Thank you. Tam used to be my research officer. She helps me along here. The next one is staffing. This is what it looks like in, say, a DC's office. So you have down here the DC and CEO. The CEO is the head of the cities and the DCs are head of the districts. They're appointed by the OPC from Capitol Hill. So you've got in a district, DED's a district, DC is appointed on Capitol Hill, and those have become now political appointments. And the people below them feel that. They realize they cannot now go into a DC job without becoming politicized. Then you've got here, on the right, the local health staff. That would be your people delivering health services, your local education and water staff. Now, each one of them is appointed by their district, by the ministry officials in the capital. So you've got the Ministry of Health appointing the health staff. Even though they're working in the district for the DC, they're appointed by their own ministries, and they answer to their own ministries. Then, so this is health, education, and water. And then you've got these accountants running around in the districts. And down there, at that level, they're working in education, health, water, the DC's office. They're working all over. But they don't answer upward or to the sector people. They answer to the accountant general. So what you have here is the local people will answer to the DC about their funding, but often they don't really. And they answer across this way about technical issues. The problem with this setup is that you have sector managers. So say you're the boss of the health system in DEDSA, your staff they don't work for you effectively. So you can't discipline them. You can't hire them, you can't fire them, you can't reward them, you can't sanction them. So that's one problem. The second thing is this dual reporting. So you've got people that head these different sectors at the local level answering to DCs and to the ministries. So it's a dual reporting. So it's not clear who you tell what. In the city, which I love doing research in the entire city, but in the city it's even more confusing because it sits within the district. So you've got the city health guy answering to his CEO, but he's also answering to the ministry in Lilongwe, but he's also answering to the district health officer, the DHO, about anything where they have joint work, so they run the same clinics together and things like that. Or if there's a cholera outbreak, then they have to work together. So there's a whole other layer in there that causes more problems. Now imagine you're some person sitting in DEDSA and you want to complain about your local guy who's supposed to be delivering you health services. there's no way to do it because he's not hired by the health department there. His boss is going to be in Lilongwe. So it makes it really hard for local level people to interact with the service providers in any sort of accountability relationship that we like to think is going to drive development. So one of the two things that need to be taught to donors is when you do your swaps, which, because all these are, swappable, you must go in there and look at the institutional structure as it exists and bring some rationality to it. And you don't build swaps around. If you really believe in decentralization, you have to build not just the central level, you have to build at the district level as well and empower people in local development. You also, now is in Malawi, everybody's talking about doing public sector reform again. It's been off the agenda for 15 years, but it's back. If you're doing public sector reform, you need to do functional reviews right down to the lowest level. You can't just stop in Capitol Hill. I know it's nice to stay in Lilongwe, but you've really got to get out there in the districts and do it. The third one, this is, very briefly, is up in Rumpi, and it's sewage that's running out of the prison at Rumpi, which used to be an office block, and it runs into the Rukuru River. And we found that the district environmental health officer there knew about it, and he'd known about it for a year at least, but yet still it was running into the river, and downstream we found people using the river water. So the question we are asking is, why isn't this solvable? Why hasn't this been solved? And the reason really is, we expect this environmental health officer to have a boss somewhere and this principal-agent relationship to work, but it doesn't work. He's not accountable to the people downstream. He's not accountable even to his boss, who doesn't know anything about this, because nobody will have ever reported this to the boss until we got there, and then it changed the whole nature. We became part of the solution. But it's basically an information asymmetry problem here, in that the kind of information doesn't flow downward or upward to get these kind of problems solved. There's nobody there to monitor the environmental health officer to make sure that that relationship between the principal, whoever it would be, his boss or the people or the politicians or the DC, to make sure that he actually performs that he's supposed to do, as he's supposed to do. And this is really pervasive across Malawi, that relationship is weak between bosses and juniors. Supervision is weak, discipline is weak, non-compliance is common. So I think the lesson for donors is, when you talk about citizen voice, we can't make the assumption that people are going to have the information about what's happening even upstream a mile. We should not assume that they know how to tackle these kinds of issues. In this case, who would they go to? And that when we have weak voice and accountability like that, that what we need to do is build stronger systems of discipline to make accountability upwards rather than simply downwards. The fourth case, and this is where I'll finish, another not great picture, but it's a picture of a Rumpi hospital with a woman carrying a pail of water, toting water to the patients. When we arrived in Rumpi, we talked to district staff about the major financial problems that was going on in the health sector. And what we found, that against the wishes of the senior health sector official, the Rumpi district commissioner, with the approval of the rest of the sector leaders, had created a single ORT account, basically an operational account for all of the sectors. And the reasons that they did this was because health has lots of money, because donors keep pumping lots of money into the health sector. So The rest of the sectors have very little money in comparison. So rather than just have a health sector budget, you make one budget, you put all the money in, and then everybody can draw from it. And that was exactly what was happening. So that within a few days of the money arriving for health, it was gone, and the health sector checks were bouncing. And these health sector guys were trying to find out why this was, and they never could get real answers from the DC or the banks about it. But the problem that resulted was that the hospital then owed huge amounts to the water board, the electricity provider ESCOM, and that after the servicing of the debts, they basically had no money to run the hospital, or very little money. So what you were finding there were shortages of drugs, ambulances not working. The cooks, rather than using electricity to cook the food, they were cooking on wood fires out the back. They were, to save on electricity costs, the ambulance wasn't working, and in the period that we were working there on 2 different occasions, they had the water company had shut off the water. So these women called guardians, the ones who come to the hospital to take care of you, were carting water from the well or the borehole outside to service the patients. And we kept going back every 3 months because one of our researchers lives up there, and we found that the situation continued to deteriorate after the Cashgate situation, and money was being pulled out of the health sector even more. But the real problem has to do with this, well, I mean, of course, lack of funds, but it also has to do with a lack of oversight. So because decentralization has been so ad hoc, and one of the questions DIF had asked us was, why is it good in one district and why is it bad in another district in the same sector? The reason is because with ad hoc decentralization, you've got a whole stream of institutions that differ everywhere you go, because nobody's ever regulated it in any sort of formal, ruled it out in any sort of formal way, either across sectors or across districts. And so if you get a DC like this one who says, I'm going to create my own banking system and I'm going to do it my way, you'll get one thing, and then you go down to Chihuahua and you'll find a completely different way of running the district. And so this was really interesting, I think, for DFID in Malawi to begin to understand why they could put money in one place and not another and find good outcomes. So I think what we need is to, again, the same sort of solution is to re-standardize. If we're going to really do decentralization, we need right from the top to begin to standardize this. And certainly people that we have met in the OPC are interested in doing that. It will depend now solely on the politicians. So most of the work that we did was building on technical work that had been done in the sectors, but trying to put looking at the governance explanations for why things weren't working as well as they should. The question that remains now with the new councillors is one that EDGE is going to address is, we've got councillors. Are they going to be able to fix this? The stuff that Tam was talking about, the kinds of examples that I've been given here. Are these councils strong enough to be able to fix this? But before we turn to EDGE, we're going to listen to Andrew talk about between the service providers and the people.